NBC 7 News Midday starts now.
Okay, welcome back. Today's weather, great example. Summer is here, and how. This summer, we're going to be looking at temperatures this summer. This weekend, we're going to be looking at temperatures that does it like over 115. It's here to stay. Skin cancer. You hear about it, but do you do anything about it? Dr. Melanie Palm. She is the founder of, founding director, Art of Skin MD. You're up in Solana Beach.
I am.
And basically, you have spent years now researching and figuring out ways to protect our skin. You live in Southern California. We got to do something.
And notice that we don't have the tan, so I try and live and breathe it.
And so many people do. There are still those of us who love to get out in the sun. And it really is. We're idiots if we do, aren't we? I mean, basically, we got to be wearing hats and clothes to protect ourselves and a lot of sunscreen.
Yeah, so that's really the first thing, avoiding peak hours and wearing sunscreen, which we'll talk about some of those.
All right, real quick. We only got a couple of minutes. Let's talk about moles, because melanoma is the worst cancer. I mean, it's just so prevalent.
Yeah, about 77,000 people will be diagnosed each year, and it's very lethal. So early detection means a good cure. So
okay, ABCD of the, how do we detect that?
Yeah, so ABCDEs, asymmetry, so something doesn't match itself. The border is irregular. This is actually a melanoma on my patient from last month. C is color, couple of colors. D is diameter, if it's larger than about a 6 millimeter or pencil eraser. And then E is the most important, so evolution. If something is new or changing, itching, painful, bleeding, that's a problem.
Okay, so if there's changes in those moles too, you got to get to your doc ASAP. All right. That's the melanoma. Just skin cancer, period. Too much sun. What can you tell us, and how do we do? And there's all kinds of stuff out there.
So the two most common forms of skin cancer, basal cell and squamous cell, we know are related to sun exposure. So you want to do everything you can to protect yourself. I tell patients, I want you to live your life, and obviously we live in San Diego, but be responsible using SPF 30, a broadband spectrum sunscreen.
I got a friend who's a doc. He says SPF, make it time. If you wear 15, you need to put it every 15 minutes. Do you agree?
You need to reapply frequently. Okay, absolutely.
We could talk forever on it. It's such an important. Thank you so much for coming in, Doctor. Appreciate it. All right, back to you, man.